Dear students, Assalamu alaikum. I am Professor Dr. ABM Omar Faruque, Professor and Head Department of Anatomy, Boshundara Addin Medical College. Today I am going to discuss the plan of development of head neck region. You know, head neck region is a very complicated and comprehensive developmental issue. Mesenchyme for formation of the head neck region is derived from paraxial, lateral plate mesoderm and neural crest cell. Thickened region of the ectoderm known as ectodermal placoats. Paraxial mesoderm, which is called somite and somatomyards, forms the floor of the brain case and a small portion of the occipital region. All voluntary muscles of the craniofacial region, the dermis and connective tissue of the dorsal region of the head and the meninges caudal to the prosencephalon. Lateral plate mesoderm forms the laryngeal cartilage, arytenoid and cricoid, connective tissue in this region. The neural crest cell originate in the neuroectoderm of forebrain, midbrain and hindbrain regions and migrate ventrally to the pharyngeal arches, rostrally around the forebrain optic curve into the facial region. In these locations, they form midfacial and pharyngeal arches skeletal structures, and all other tissue of this region including cartilages, bone, dentin, tendon, dermis, pia and arachnoid, sensory neurons and glandular stoma. Cells of the ectodermal placoats together with neural crest forms neurons of the 5th, 7th, 9th, 10th and cranial sensory ganglia. This is the basic principles which I have mentioned in last few words. Now, I am going to elaborate the specific regions. The development of head, the anterior portion of neural tube expands greatly to form and as forebrain, midbrain and hindbrain. Development of face. The first, second and third arch play an important role in development of face, mouth and tongue. Initially, the primitive mouth cavity or stomodium is at the first bounded above or rostrally frontal prominence, below or caudally, developing hard and laterally first pharyngeal arch. Here is the picture. This is the frontal prominence, especially this is the guard and the bulging of the cardiac bulging, and this is the buccopharyngeal membrane. This is the primitive conditions of the development of head and neck shown in this picture. About 24 days of development, the first branchial or pharyngeal arch produce anterior process, the maxillary process. So, now stomodium is bounded. This is the stomodium, picture is shown in stomodium. Above is bounded frontal prominence, below maxillary prominence, laterally first branchial or pharyngeal arch or mandibular arch. Early development of face is dominated by proliferations of the migrations of ectomesenchyme involved in the formation of primitive nasal cavities. About 28 days, end of 4th week, localized thickening develop within the ectoderm of frontal prominence, just rostral to stomodium called olfactory placoats. Around the placoat, the underlying mesenchyme becomes proliferate and about horseshoe shape ridge that converted the olfactory placoat to nasal pit. The nasal arm of nose show is called lateral nasal process. The medial arm of horseshoe is called medial nasal process. The portion nose develops from the frontal prominence is called frontonasal process. Here is the picture. This is frontal prominence, frontonasal process, stomodium, and this is the first arch. Now, lip formation. So, the medial nasal process of both sides plus frontonasal process fuse to give rise middle portion of the nose, middle portion of the upper lip, labial compartment, anterior portion of the maxillary carry 4 incisors and the primary palate palatal components. Here they are showing the picture of lip formation with their consecutive teeth. The lateral portion of the upper lip is formed from the fusion of the maxillary process of each side, the medial nasal process within the counterpart of the opposite side. The lower lip is formed by merging of two streams of the ectomesenchyme of mandibular process. The maxillary process grow medially at approaches the medial and lateral process. They are separated by distinct groups. Maxillary process, medial nasal process, bucco-nasal group, and maxillary process, lateral nasal process, naso-optic group. As the maxillary process and lateral nasal process are separated by naso-optic group, the epithelium of the floor of the group between them floors solid core and canalized to form the nasolacrimal duct. Its upper end winds to form the nasolacrimal duct. The face develops between 24th and 38 days of gestation. Maxillary process enlarged to form the cheek and maxilla. Nose is formed from the 5 facial prominence. Frontal prominence give rise to breeze. The merged medial nasal prominence provide the crest of the lip. The lateral nasal prominence form the sides or ala of the nose. This is a pen picture or summarized view of the prominence and what structure derived from prominence. Frontal prominence, frontonasal prominence give rise to forehead, breeze of the nose, median lateral nasal process, maxillary process, cheek, maxilla, lateral portion of the upper lip, medial nasal process, philtrum of the upper lip, crest and tip of the nose, lateral nasal process, ala of the nose, mandibular process, lower lip. This information is very important for the professional examinations and also in Viva. This is a pictorial presentation of the development of face during 12 to 13 weeks. The 4 weeks means the measurement is in millimeter. This is the final 8 weeks of development, 28 millimeter in diameter. At last, the intermaxillary segment. As a result of medial growth of maxillary prominence, the two medial nasal prominence merge not only in the surface but also deeper level. The structures formed by two merged prominence is the intermaxillary segment. It is composed of a labial component which forms the philtrum of the upper lip, upper jaw component which carries 4 incisor, and palatal component primary palate. This is the chief and fundamental information about the source and developmental process of structures of head, neck and face. In subsequent class or review class, we shall try to summarize the individual development of face, tongue, larynx, pharynx and other structure present in head and neck region. And thank you for your patience. Thank you for cooperating me. Assalamu alaikum.